Hello guys, welcome once again at my YouTube channel where your health is our priority. And in this channel we usually discuss health issues concerning women, and in today's topic we are going to discuss about urinary tract infection. So what is urinary tract infection? Urinary tract infection is invasion of any part of the urinary system by the bacteria, starting from urethra, the bladder, the ureters, and the kidney itself. So from there we proceed to risk factors associated with urinary tract infection, or factors which now predispose an individual to get urinary tract infection. So number one is the general female anatomy, where females generally have a very short urethra, approximately 4 centimeters, which makes it very easy for bacteria to penetrate through the urethra and reach the bladder. Then number two is unhygienic practices, especially in women, where they wipe from back to front. Then number three is sexual activity, which may introduce the bacteria into the genitalia. Then number four is conditions such as diabetes mellitus, where the high sugar content in the blood causes the bacteria in the urinary tract to multiply and grow. Then also catheterization, especially if the catheter is in situ for more than 2 weeks. Then also conditions such as pregnancy, because now the fetus in the uterus, it compresses both the bladder and the ureters, causing urinary stasis. And as a result, the bacteria are able to multiply and grow in the urinary tracts. Then also a very common issue or a very common risk factor is dehydration, where women, they don't take water frequently, and as a result the body is not able to flush out the bacteria in the urinary tract. So as a result, now the female starts experiencing these signs and symptoms of urinary tract infection. From there we proceed to signs and symptoms of urinary tract infection. The most common ones are burning sensation or pain while urinating, crowded urine, backache, increased urinary frequency, and others, they may also present with blood in urine. Then from there we go now to classification of urinary tract infection. Urinary tract infection is classified into two: uncomplicated urinary tract infection and complicated urinary tract infection. Uncomplicated urinary tract infection is generally found in healthy women, and it is not usually associated with any secondary condition or infection such as diabetes, hypertension, benign prostate hypertrophy, among others. While complicated urinary tract infection is now the one which is associated with other secondary conditions such as diabetes, kidney stones, benign prostate hypertrophy, diabetes mellitus, among other conditions. So from there we proceed now to management of urinary tract infection. Management of urinary tract infection is one based on whether it is complicated or uncomplicated. Additionally, there is the pharmacological management and non-pharmacological management. So we start with uncomplicated urinary tract infection. So uncomplicated urinary tract infection, non-pharmacological management usually involves advising the patient to take a lot of water to enhance the flushing out of the bacteria, and also to maintain proper or appropriate hygienic practices. For example, as I had stated in risk factors, wiping now from front to back to prevent the entry of bacteria into the genitalia. Then the pharmacological part of it, we use the simple drugs such as nitrofurantoin, amoxicillin, or amoxiclav. Then we go to complicated urinary tract infection. This is where we use intravenous drugs such as ceftriaxone 2 gram stat. Then we discharge the patient on drugs such as amoxiclav 625 or ciprofloxacin. Thank you guys. See you once again.